Hi everybody, we're doing a video today of going to a patient's home who is suspected of COVID. So we're gonna dawn outside the patient's exterior door by hanging our bag on the doorknob. So I'm accessing my PPE grab bag. Prior to the visit, I had added some extra gloves to the PPE bag and also some sandy wipes. In addition, I had prepared, as we showed in the bag technique video, our equipment bag with our necessary equipment: blood pressure cuff, stethoscope, pulse ox, thermometer, and thermometer cover. So that's all pre-prepared in our separate Ziploc bag. Okay, and then we're going to take our equipment bag and just add it to our PPE bag. So everything is all together. Lift up and go into the patient's home. Okay, so we want to try to set up our bag and our garbage close to the door and far away from the patient. So if possible, on a chair or table nearest to the door, we can ask the home attendant if they can bring us a chair or a caregiver to set up our bag. So we'll place a chuck place our bag. Setting up some additional chucks for our equipment. We have some masks in here for caregivers to hand out. Check them out. And we have a garbage bag for our stomping that we'll set up near the door. So we're now going to go examine the patient. We have our bag of equipment all ready. we're gonna go to the patient's room, and while we're gone, we're gonna try to cover this so that this is gonna be a clean chuck where we're gonna place clean equipment later. So we want to try to cover that to keep it clean. Okay, so we're back from examining the patient. This is our dirty bag of equipment. When you examine the patient, we're putting everything right back in the bag, nothing on the bed or on any other surface. So this becomes our dirty, contaminated bag. We dump out the equipment. We throw away the bag. And then remove our gloves. We'll get out our wipes to wipe down our equipment. We'll get out some additional gloves. The wee glove. Make some space here. All right, do you want to cut it for a second? So put one wipe to wipe our alcohol sanitizer afterwards. Take a couple out for our equipment. All right, we had set out a wipe for the hand sanitizer, which we'll just wipe down because we've accessed it a few times. And I'm trying to make my best effort to pick up the items with the sandy wipe so that we're not contaminating. Okay, so we'll wait for wet time, and then we'll change our gloves again to put our equipment away. Again, I had added a couple pairs of gloves. The PPE bag has one glove of each size, one small glove, one medium, one large. Medium, so I added a couple medium pairs. We're also going to be using the sanitizer when we doff, so we're going to leave out one more wipe with our sanitizer. Leave it over here for after. Okay. Get a new bag for our equipment. Trying to keep it away from my contaminated gown. And then we'll replace it in our bag. Okay. All of this gets thrown away. go to buy our garbage bag by the door to doff. Start with our shoe covers, with our gloves on. Fold them over. Work on our balance. We followed the CDC doffing guidelines, which were to sanitize at the end after you have doffed everything, unless your hands become contaminated by touching contaminated PPE. The World Health Organization has sanitizing in between each step, so you can use your judgment. We're following the CDC guideline. We will remove our N95 once we're outside. And we will kindly ask the home attendant to dispose of the trash.